Urea solution with prefilled applicator is used to treat dry, rough skin conditions such as eczema, psoriasis, corns, callus, and some nail problems like ingrown nails. It can also help remove dead tissue in wounds to aid in wound healing. Urea is known as a keratolytic, which means it increases moisture in the skin by softening and dissolving the horny substance, keratin, holding the top layer of skin cells together. This helps the dead skin cells fall off and allows the skin to retain more water. It is recommended to apply the solution at the same time each day for the best results. When using urea solution with prefilled applicator, it's important to follow the directions on the product package and prescription label. If you're unsure about anything, don't hesitate to ask your doctor or pharmacist for guidance. Depending on your skin condition, your doctor may recommend applying the solution 1 to 3 times a day. Make sure to rub it in well until it's absorbed, and wash your hands after applying, unless you're treating your hands. Be careful to only apply the solution to the affected areas of the skin or nails, and avoid sensitive areas like your eyes, lips, mouth, nose, and vaginal/groin area, unless directed otherwise by your doctor. It's also important to check with your doctor or pharmacist before applying the solution to certain areas or types of skin. Using this medication regularly will help you get the most benefit from it. And if your condition persists or worsens, be sure to inform your doctor. If you experience burning, itching, stinging, redness, or irritation, make sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. In most cases, people using this medication do not experience serious side effects. However, if you notice any unusual changes in your skin, such as blistering or peeling, or signs of a skin infection, you should contact your doctor immediately. While it's rare, a serious allergic reaction to this drug can occur. Seek medical help right away if you notice any symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, make sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and if you're in Canada, you can report them to Health Canada. Before using urea solution with prefilled applicator, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of skin cuts, infections, or sores. Some products may increase your sensitivity to the sun, so be sure to check the label for any warnings. Your doctor or pharmacist may recommend that you limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing. If you notice any sunburn or skin redness, inform your doctor right away. This product may also stain or discolor clothing, so ask your doctor or pharmacist for more details. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding, especially if you are applying this product to the breast area. When using urea solution with prefilled applicator, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. If swallowed, this medication can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. U.S. residents can call their local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. It is important to take this medication as directed by your healthcare provider and to follow the recommended dosage and timing for optimal effectiveness. This medication is for your use only and should not be shared with others. It has been prescribed specifically for your current condition, and should not be used for any other condition unless directed by your doctor. If you need a different medication for a different condition, your doctor will provide guidance. If you forget to use a dose, use it as soon as you remember. If it's close to the time of your next dose, just skip the missed one and use the next dose at your usual time. Avoid using more of this product or using it more frequently to make up for the missed dose. When using urea solution with prefilled applicator, it is important to store it at room temperature and avoid freezing. Keep the foam product away from heat and open flame, and make sure to store it in a safe place away from children and pets. Do not puncture or burn the container, as the contents are under pressure. It is crucial to properly discard the product and it is expired or no longer needed. Please consult your pharmacist or local waste disposal company for guidance on the correct way to dispose of the product. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. Thank you for watching. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.